right, welcome back to the Morning Show here on Rise News. Moving on, and exactly many things to talk about. 11 years ago, World Contraception Day, WCD, a global campaign dedicated to improving awareness of contraception to enable young people make informed decisions and push for better education when it comes to sexual and reproductive health, was launched.
Yes, a very interesting topic there. The annual worldwide campaign centers around a vision where every pregnancy is wanted.
All right, joining us now from Abuja studio is Farouk Jega, who is presently the country representative for Nigeria and Ghana at Pathfinder International, where he oversees technical and administrative aspect of a multi-million-dollar portfolio of projects in maternal health, family planning, HIV/AIDS, and advocacy in 2 countries, including an innovation intervention to address maternal mortality through a multi-pronged community and health system strengthening project. Great to have you, Dr. Farouk Jega.
Thank you very much for having me.
All right. At first, can you talk us through the need for a proper understanding of sexual and reproductive health before we segue into the conversation on contraception?
Well, yes, sure. Human beings, have some natural innate abilities. One of which, is the ability to procreate. That's the ability to reproduce. And there are certain responsibilities, obviously, that should go along with that, concept. Sexual reproductive health, encompasses a large, aspect of the health and well-being of individuals. It connotes the ability to have pregnancies that are wanted, that are very well cared for, and it also suggests, that all pregnancies, should go through a normal and natural cycle, and at the end of the day, should lead to the delivery, of a healthy, offspring that, can be the pride of the nation, that can contribute to nation building. Reproductive health, obviously, is a very wide health area that involves a lot of, other areas, that have to do with contraception, that have to do with treatment of infertility, and also some reproductive health cancers. Gender issues, gender norms that, define us as a society, are also embedded within the concept of reproductive health.
So, sir, can you tell us the significance of the World Contraceptive Day, and can you talk us through the theme for this year?
Yes, the theme for this year's World Contraceptive Day, it's your life, it's your responsibility. And it's, I think, a very, very good opportunity to raise awareness, around the unique role of contraception and family planning in nation building. We are all aware that our population in Nigeria is growing at a very, very rate. Our annual population growth exceeds 3%. And, while the population numbers in itself is not such a bad thing, I think the problem we have is that our GDP, our economic growth, is not keeping pace with our population growth. So for all the additional millions of people that we add every year to our economy, we've got many mouths to feed. We do not have nearly enough schools, enough hospitals, enough jobs, and also other key social infrastructure. So there is a lot of benefits, to contraception and family planning. The foremost of which, obviously, is the health and well-being of societies. Pregnancies that are very well spaced, together, give women and families, the chance to improve their health and well-being. The children themselves, offsprings of such pregnancies, also tend to be well catered for, more nourished, and thus healthier. So contraception have a key role in ensuring, not only the health and well-being of societies, but also the economic growth of a nation as well.
All right, let's talk about culture, the role of culture in all of this. I mean, I think it was somebody that said, no matter how good your strategies are, culture, we always have it for breakfast, So culture in all of this, the culture of the people, how receptive are we to contraceptive methods?
It's very significant culture because obviously I think you have mentioned the fact that everything we do, is viewed through our, norms, our social constructs. I think the concept of contraception or family planning, goes back in time, a very, very, very long way. I think what is alien, to our culture is the concept of modern contraception or modern family planning. As you know, and I'm sure many of our viewers know, that there are many natural, methods of contraception. We know, for instance, certain cultures where a woman, goes away and lives with her family after she has had a child, sometimes for up to 1 year, sometimes for up to 16 months. That's family planning. She's basically, just being removed, from her husband, so she has a chance to, recover from the pregnancy and the childbirth, and obviously also be able to raise her child very well. There are also very many other, natural methods, from herbs, to, other natural things that people use. I think the issue that most people find alien to their culture, is this concept of modern contraception. And there are several, new modern methods that are very, very, very effective in terms of providing contraception. But, because of, that issue of culture, that we talked about, that's where the problem is. So family planning in itself is not anathema, to our culture. I think it's the concept of the new modern methods, that are very, very scientific, very, very effective, are not without, obviously, some, minor irritations and side effects. I think those are the issues that, that our culture, has a problem with, if you like.
Just to follow up on the side effects, I mean, the reason why a lot of people say they don't do this is because of the side effects. People have said some methods predispose them to some forms of cancer, some methods cause so much bleeding, some methods even led to death in some very unverifiable extreme cases. Some will surmise that way. What's your take on this? Almost straight on.
Well, yes, there are certainly some minor irritations, as I said, side effects. But I think, just to put it right, most of the people that don't use family planning do so because they want to get pregnant, not because they are afraid of side effects. Side effects is a small component, that contributes to why people generally don't use family planning. And the side effects, so that there is absolutely no family planning modern method that is ideal. There are certainly a lot of methods that are quite safe and very, very effective in providing contraception. The side effects mostly are minor irritations and usually self-limiting, with time. And they range, as you mentioned, from, bleeding disorders. I think they are by far the largest side effects of modern hormonal contraceptions. Weight gain can be a problem, but the attribution, or rather what people out there think about side effects of family planning are not nearly as big an issue, as the side effects themselves. Usually people who are counseled very well about the particular side effects they should expect, tend to tolerate those side effects and tend to, continue using those family planning methods. The side effects, I need to emphasize, are usually minor and are usually self-limiting over time, and they can certainly almost always be treated. But there are, instances where, women have erroneously believed, that even other symptoms that they are experiencing at the time they are using a certain method is as a result, of that method. I think what people generally need is a lot of information that these side effects are usually not life-threatening, they're usually very minor, and that they usually tend to resolve over time.
Now, bringing it back to the theme of this year, what is Nigeria's family planning goal? And to what extent is Pathfinder helping the Nigerian government to achieve this?
So Nigeria's federal government has a very ambitious goal of increasing the contraceptive prevalence rate. That's the proportion of married couple that use a modern method of contraception to 36%. In the next couple of years. We are currently at 15%, so we're basically looking to, almost, double that. That's very, very, very ambitious, but it's also very, very achievable because the federal government has done a lot of things, there are a lot of policies that are enabling. The federal government has also, I think about 5 or 6 years ago, also introduced a policy to provide contraceptive services and commodities free of charge in the government's public hospitals. I think what needs to happen, is a lot of awareness, needs to be created. At the same time, I think state governments also, absolutely need to step up and support the federal government. After all, almost all the service provision happens at the state and the local government levels. And so even when the commodities procured with federal government funds are available, there are other things that need to be provided. So training of healthcare workers on some of these technologies are relatively new. Provision of equipment and other consumables on an ongoing basis, it's also, very, very important. But I think going back to the issue of culture, that we talked about, it's very, very important that the government, especially at the states and local levels, also engage, with some of these custodians of our culture.
I just quickly want to talk to you about this on the lines of the UN General Assembly, 74th General Assembly currently going on. Maternal health, maternal mortality is a big issue on the front burner. Is there a possibility to be able to curb this? Because when you look at the healthcare infrastructure in Africa, it looks in a very dire situation. The numbers are stacked up against us.
Absolutely, yes. The numbers are really staggering. But you know what? The good news is that we know exactly what to do. Addressing maternal mortality has been done in many, many other countries similar to Nigeria. It may interest you to know that even some of the more developed countries, like the UK and many parts of Europe, have maternal mortality numbers similar to what we have currently about 100 years ago. So we know exactly what to do. The technologies, the treatments, options are all available. I think what we need is the political will to make the necessary investments in the health infrastructure that you talked about. And most certainly family planning is one key intervention that saves lives, reduces maternal mortality, and improves health and well-being. Family planning investments, it's very, very cost-effective. For every dollar that is invested in providing family planning services, there's a multiplier effect that can help along the line to save the lives of many, many, many more women and their children and their babies as well.
Okay.
With the recent cut in the family planning budget in Nigeria, how feasible is it to meet our goals for 2020?
It's definitely a setback, but I think it's one that has been addressed at the very highest levels of government. We've had the president and the vice president talk very positively about the need for us to make investments in family planning. I think in the short term, there may be some perhaps maybe hiccups in terms of the commodity supply. But I am very, very confident, that with all the actions of civil society and the very positive engagement with government, that this is not going to very adversely affect the family planning program. Obviously, it has the potential, of causing major disruptions. But I believe, that with the traction and with the allies and the leadership in the ministry and other government agencies, that this, will be tackled very soon.
We all know that there's a direct correlation between sexually transmitted disease and sexual and reproductive health and family planning. We remember the works very glowingly of the likes of Ambassador Shotime when he was in charge of National National Council on AIDS and the likes. I mean, what work are we also doing, or what work is Pathfinder doing to be able to ensure that, some of these methods for family planning, as it were, there's a far-reaching effect as regards prevention of sexual and reproductive health diseases that is being transmitted through sexual intercourse?
Yeah, thanks. You asked a very important question. Pathfinder works globally and also in Nigeria to support the government's, program of integration. So, sexual and reproductive health programs are by nature, integrated into one another. So the family planning program is very closely aligned and integrated with the sexually transmitted infections and the HIV/AIDS program. So there's a concept of duality or dual protection, whereby a family planning method is meant to provide not only contraception but also protection against sexually transmitted infections. Previously there has been several efforts to bring the disease prevention STI program and the family planning program under one roof, and I know that this has been successful in many service delivery areas where a prospective client will get not only counseling and provision of contraceptive services, but also counseling, screening, and protection, and possibly also treatment for sexually transmitted infections. So if you look at across board, there is a very high degree of success of both the contraceptive component and the disease prevention or STI prevention component. If services are integrated, it saves the government money, it saves the client the trouble of having to make multiple clinic visits. And I think sexually transmitted infections and pregnancy and contraception have a lot of commonalities, and so we can very comfortably and nicely talk about all of them and address them in the same hospital visit. And that's what we have been doing to support the government.
I mean, also this conversation is going to segue into sanitary care too for young girls, because sanitary care, especially when they're having that time of the month for them, is another factor. I mean, a lot of them have gotten pregnant, or there's the high incidence of teenage pregnancy because a lot of them can't afford sanitary care, and the people that give them the money end up wanting to have sexual intercourse with them. In fact, there's a story making the rounds in some part of Africa that what some young ladies are now doing is they're using contraceptive methods or contraceptive injections as a way to be able to prevent their flow, so that they don't have to go meet men and source money to be able to get sanitary materials to protect them. What's your take on this?
Yes, it's true. Again, the issue of menstrual hygiene is a big one, and it mostly impacts adolescents. I'm aware of many societies where young girls have to leave school during their menstrual cycles. It doesn't have to be. I think there's a lot of educational component, that needs to happen. Pathfinder and others are generally raising awareness through our adolescent reproductive health programs, in schools and out of schools to, generally educate young women about their bodies and about what to expect. There are a lot of programs, that provide subsidized menstrual hygiene products, to adolescent girls. But I think the biggest intervention, and one which we are definitely involved in, is, the one around menstrual education. There are very, very cheap products that are sustainable, that can be recycled, that can be used. But the part of, where young girls are stigmatized because of a God-given reproductive function, I think it's one that needs to be adequately addressed through proper education and enlightenment.
All right, I'll say a very big thank you, Dr. Farouk Jega.